Hi, so right now I'm going to be doing my injection practice video. Obviously for the real test out on week 8, I'm going to be in uniform, and some of the stuff that I'm going to be using is props. I'm going to have the real stuff, like I'm going to be using, this is my gauze today. This isn't actually gauze, but I'll try to have some real gauze for the actual test out, and there might be some other things as I go along the way. Also, under the patients, I did not find any sub-Q injection patients, only intramuscular. And for this practice video, we're supposed to do the sub-Q video. So I looked at the patients and all I saw was intramuscular injection. So I'm just going to go, I'm not sure if we're supposed to have a patient. If we are, please clarify. Maybe I missed something. But for the real test out, I'm sure obviously we're going to have a patient and go in the MAR, and we're actually going to be charting. And we're going to be giving them the meds based on the individual patient, like a real test out. So, okay, so I'm going to begin now. So just like the last practice I did, the first thing I'm going to be doing before the sub-Q injection is checking the MAR. So I'm going to be on EHR Tutor. I'm going to be looking at the date, the patient name, the drug name and dosage, the time for administration, as well as the route of administration. Then the next thing I'm going to do is check the patient's chart. I'm going to be looking for allergies, as well as any parameters for withholding the medication. So I'm going to look at the patient's labs, their apical heart rate, their blood pressure, and any other physical assessments that could possibly cause me to withhold the injection. So I'm going to identify what teachings I might need to provide to the patient. So for instance, for the last test out, for the medications I'm giving them, you might want to tell your patient what to report to you, like any signs and symptoms, any adverse effects from the medication. So based on whatever meds I'm giving, which I'll be prepared for the real test out, I'll make sure that I know what to tell my patient. And if I had a practice patient today, which if we do I cannot find it, I'll let them know about the medication. So if anything goes wrong, I'll make sure they let me know. I'm going to gather my equipment. I've got my alcohol swabs right here, my gauze, the proper syringe. This is the sub-Q syringe. We have a intramuscular and a sub-Q. This is the sub-Q syringe, which is the 25 to 27 gauge. Let me make sure which one, I have the right one. This would actually be the sub-Q one. I take that back, I had the wrong one. Okay, so this one is the wrong one. This right here is the sub-Q one. So for this one, the sub-Q, it's 25 to 27 gauge, and that's the 3/8 to 5/8 inch. So I have that right here. I have my alcohol swabs, my gauze, and my gloves. I'm going to perform hand hygiene right here, so I'll have my hand sanitizer. I'm going to state the 6 rights of medication administration: right patient, right dose, right time, right route, right documentation. Right patient, dose, route, time, documentation, and route. And the next thing I'm going to do is read the MAR and select the correct medication. That'll be my first check. And then I'm going to check the expiration date on my medication, which here's my sample medication right here. And I'm going to check all the medications if I'm administering more than one. I'm going to compare the MAR to the label on the container, so I'm doing that right now, verifying that it is the correct medication. And then I'm going to verbalize that I'm going to calculate the amount of drugs to be given to the patient. So I'm going to calculate the right amount of drugs. And then the next thing I do is prepare the medication in the syringe. I'm going to visually inspect the medication for color, clarity, or sediment. I'm going to have the alcohol swab available. Then I inject the air into the vial in the desired volume. So for the actual test out with the med, I would be doing that. I would draw that into the syringe, withdraw the correct dose, and then I want to recap the syringe without scooping, with the scooping method to transport it to the patient's room. And then if I don't administer it immediately, I do want to change the label the syringe. I will then check the label of the vial, ampule, the pre-filled syringe, and compare it to the MAR, and that'll be my third check. And once I have everything ready, when I enter the patient's room, the first thing I'm going to do is perform hand hygiene in their room. So I would do that. I'm going to identify myself, so I'm going to tell my patient here, my name is George, I'm going to be your nurse for today, and I'm going to ask the patient if they could give me their name and date of birth, and then they do. And I'm going to compare it to the EHR, the patient's wristband, to make sure that it is the right patient, that everything matches. I'm going to ask my patient if they have allergies and check the allergy band to make sure that they don't have any. I'm going to close the curtain to ensure privacy. I'm going to explain what is going to occur, so I'm going to explain what medication I'm going to be injecting today. I'm going to allow my patient for any questions they might have. Raise the bed to a comfortable working height. Don the gloves. So this is the part where these gloves are a little tight. I think I grabbed the wrong size. I have a bunch of sizes, but I'll grab my gloves. I'll probably get bigger ones, but these are a little small, but don them. And then once you got both gloves on, you're going to scan the patient's wristband, and then you're going to scan the medication. So I'll scan the wristband, and then scan the medication. And then this was something I had to prioritize last time. I'm then going to correctly record the medication on the MAR. So not until you're ready to administer it do you record it. And then I'm going to go collect any data such as the pain level, the blood pressure, or the pulse. So I've got my blood pressure cuff and my stethoscope here. I could ask the patient if they're in any pain, check their blood pressure, check their pulse. I'm going to check the MAR, make sure again I have the correct medication dose, time, and route. And then next I'm ready to prepare the injection site. So for this one it's sub-Q. It would tell me in EHR what I'm going to do. But for this one, I'm just going to do the anterior aspect of the thigh. So I'll just do the anterior part of the thigh as an example. So the first thing I want to do is cleanse it with an alcohol swab in a circular motion from the center outward. So you want to go center and then outward. And then you want to give it a little bit of time to dry. And once the alcohol dries, you want to get your gauze ready. And you want to keep it at the corner of the injection site. And once you're ready to actually make the injection, you hold the syringe between your thumb and your forefinger as if grasping a dart. So that's how you're going to hold it. And then you want to pinch the skin and insert the needle quickly and firmly at a 90 degrees. Release the skin. You want to make sure not to aspirate. And you want to inject the medication slowly and continuously. And then you withdraw gently and place the gauze over the site, but you don't rub it. So I'm going to make the injection at a 90-degree angle. And then place the gauze over there. Okay. And then once I'm finished, I want to discard the used syringe. That you never want to recap a used needle. Obviously, that's a safety hazard. And you want to place sharp objects and hazardous waste in the appropriate containers. Then prior to leaving, I'll dispose of my gloves, the alcohol swab, and the gauze pad. I will lower my patient's bed, raise rails if necessary, make sure they have their call lights and any belongings, perform hand hygiene, and then I'll let my patient know they can reach me if they need me. And that'll be it for today's video. So if there's anything I can improve upon, please let me know so I'll be ready for the test out. Thank you.